I'm Dr. Christo Zuves at HRC Fertility in Foster City, California. I practice holistic IVF, which means that I start with Optimum Health, and to that we add the maximum science, and that will get you the very best results with your IVF. Now, IVF is truly like a triathlon, and both you and I have the power to make a difference in your journey to parenthood. First, let's talk about what you can do for yourself today to increase the chances of success. We will go through dietary choices as well as supplements and lifestyle changes that you can make for yourselves, and then we can go through what I can do to bring the maximum science available to your IVF cycle. As we embrace the concept of optimum health and holistic IVF, everything is geared towards decreasing inflammation. Inflammation can be both our best friend or worst enemy, and it is inflammation that helps us heal from injury like a wound or surgery, but it can also cause chronic diseases like cancer, heart attack, stroke, arthritis, and inflammatory bowel disease. What isn't discussed enough is the role of inflammation in reproductive failure. The good news is that we now have ways to decrease inflammation. As you can see, we can start with diet, we can do mind-body work, we can make lifestyle changes, and if that doesn't get us into an optimum state, we can then add specific medical treatments to bring the inflammation down to an acceptable level. So we are what we eat. It's no secret that nutrition is very important when it comes to fertility. And here are the highlights. For optimum nutrition, we need to be gluten and dairy-free. We need to be on a high-protein, low-carbohydrate diet. And we have to, if possible, have no sugar in our diet. Because remember, sugar is more addictive than cocaine. We want to be having all the healthy fats in the form of avocados and olive oil. And we want to focus on getting lots of veggies, especially those in the cruciferous family that you see down in the bottom here. We're talking about kale, cabbage, cauliflower, Brussels sprouts, broccoli. These are all amazingly good vegetables. And to know there is a strong correlation between gluten intolerance and poor reproductive health. Patients with unexplained infertility, recurrent miscarriage, intrauterine growth restriction, and low birth weight can be traced to a gluten intolerance. Accepting that a low-carb diet is best, these are the gluten-free grains with the lowest glycemic indexes. So the gluten-free grains would be amaranth, arrowroot, buckwheat, corn, gluten-free flours like rice, corn, potato, and bean flours, millet, and my favorite carb is quinoa, and you can also have rice, including wild rice. Sorghum is gluten-free. So is soy, but we're not a big fan of soy because it does add extra estrogen and progestogens to your diet. So we know what to avoid, but let's talk about foods that we want to incorporate into our diets more often. Obviously, you can't get these into every meal, but here are the great foods to keep in mind when you plan your menus. These are all geared to decreasing inflammation. We want to look at fatty fish like salmon, sardines, herring, and mackerel. We want to have lean meats, specifically grass-fed and organic. You want to focus on berries, blueberries, blackberries, raspberries. These are all amazingly antioxidant. Also the cruciferous vegetables that we already mentioned, broccoli, kale, cabbage, and the rest of the family. Avocados are amazingly good for us. They contain those really healthy fats. Also nuts, especially almonds and walnuts for reproduction. but also peanuts, hazelnuts, Brazil, pecans, and cashews. Green tea is an amazing antioxidant, as is turmeric, a spice. We also want to make sure we get kelp, mushrooms, and peppers into our diet. And then as a treat, dark chocolate, 80% or more of cacao. You can have this as a treat, but remember, it does contain sugar. For eating, olive oil, avocado oil, and for cooking, coconut oil. And let's not forget, for men's reproductive health, sweet potato is great. So these are the foods we must avoid because they increase inflammation. Sugars, gluten, and dairy, common cooking oils and trans fats. We want to have red meat no more than once a week and avoid all processed meats. Also avoid refined grains. Snack foods are the worst. No sodas and sweet drinks. Fried foods really fire up inflammation in our system. We want to avoid alcohol completely on the egg side. And on the sperm side, if the sperm parameters are good, you can have up to 5 alcoholic beverages a week. Also, read the labels on what you're eating. We want to try and avoid artificial food additives. There's a temptation to dismiss the impact lifestyle can have, but it can make a huge difference. Anecdotally, I've had patients who have had a dramatic difference in their cycles based on changes they've made in the weeks and months leading up to treatment. For patients who want to increase the amount of protein in their diet, but also decrease the amount of animal protein that they consume, there are easy ways to do this. For example, plant-based milk like Ripple, the original unsweetened. This has 8 grams of plant protein per cup and only 80 calories, no added sugar, and 50% more calcium than cow's milk. Now, moving from the dietary and lifestyle changes that decrease inflammation to the importance of decreasing stress, which we know has a direct link to increasing natural killer activity and decreasing implantation. I know so many of you on the webinar today are high achievers. You're smart and successful, and from a young age, we've been taught that if we worked hard enough at something, we would achieve anything. The truth is that when we confront something like a chronic illness, a serious illness like cancer, or something that resists our best efforts like infertility, there is a profound loss of control, and this affects us psychologically. And because the mind and the body are connected, it affects our physiology and increases inflammation. Supplements are incredibly important, and at ZFC we will provide you with a comprehensive list of supplements. We don't have time to go through all of them tonight, but here are some of the supplements that I would like to highlight for you. For both the egg and the sperm provider, vitamin D3, about 5,000 international units a day, omega-3, about 1,000 milligrams a day, CoQ10, about 400 milligrams a day, and a good antioxidant, and the one I like best is acai, the berry from Brazil, 1,000 milligrams a day. Now, a good multivitamin for the egg and the sperm provider is really important. Try to source this with methylfolate instead of straight folic acid. And additionally, on the egg provider side, add probiotics. There's a supplement called PQQ, which is a first cousin of CoQ10. It increases the production of mitochondria in cells. One should add that. And then also extra methylfolate on the egg side, about 2 milligrams per day. On the male side, if the sperm parameters are good, you can have a regular men's multivitamin. But if there's any decrease in parameters on the sperm, you should focus on one of the specific multivitamins for male factor, like Fertile Aid, Fertile 1, or Fertility Blend for men. Smoking is one of the worst things that you could possibly do to your eggs or your sperm. Inhaling anything like a pipe, a cigar, a cigarette, or weed, inhaling that into your delicate lung tissue, it gets into your system and adversely affects your gametes. So, let's all get off the smoking if we're smoking. Now, BMI is not a perfect metric, but the research shows that both extremes decrease fertility potential. BMI is an index that factors in height and weight, and our goal is to stay in the green zone here between 19 and about 28. So this is what the research shows. If you look at BMI under 25, and then we go to 25 to 30, 30 to 35, and over 35, you can see that the pregnancy rate drops from 60% to 40% to 26%, and then all the way down to 15%. Now, BMI over 28 can have far-reaching negative effects on our health. As you can see, it can contribute to diabetes, cancer, and heart disease. But from our perspective, we're most concerned that BMI over 28 will decrease or lower the pregnancy rates when we do IVF. Once you're pregnant, an elevated BMI can also cause congenital abnormalities in your baby, gestational diabetes, high blood pressure, a higher risk of cesarean section, and also deep vein thrombosis. The good news is that if you can follow the guidelines for optimum nutrition, you can lose weight safely without being hungry, and many of my patients who have embraced the optimum health end up decreasing their BMI, which in turn increases the chances of success. So let's get with the program and start working on the optimum health so that we can make the very best eggs and sperm and embryos and get you the very best result. Please scan the QR code and set up a consultation, either in person, by video, or on the phone.